Yeah, my name is Gary Onokite. I'm still the health and wellness science and medical researcher. I'm here to discuss diabetes or diabetes mellitus 2, known as type 2 diabetes mellitus. Diabetes mellitus 2, previously known as non-insulin dependent diabetes mellitus, is the most common form of diabetes that is accounting to about 90% of cases worldwide. The causes are multifactorial and predisposing factors. They include obesity, when someone becomes obese, too fat, overweight, or sedentary lifestyle, smoking, drinking to drunkenness, beer, and using cannabis and all the rest. Increasing age, when someone gets to a range of age and is becoming older, such do happen. Predominantly, it also affects middle-aged, the 30s, and older adults. Then genetic factors, that is parents transferring it to children. Its onset is gradual, it's very small, it starts gradually, then often over many years, and it frequently goes undetected until the signs and symptoms are found out from routine investigation or a complication occurs. It actually happens when insulin secretion may be below or above normal. That is when this diabetes mellitus 2 is identified. So deficiency of glucose inside the body cells occurs despite hyperglycemia and a high insulin level. So the glucose becomes higher despite having sufficient insulin in the body. This may be due to insulin resistance, whereby the insulin become resistant to the cells and to the body system. Examples are changes in cell membranes that block the insulin-assisted movement of glucose into cells. What are the treatments involved in treating diabetes mellitus 2? The treatment involves diets, mostly diets, and there are also drugs to use to control the blood sugar level. Although sometimes it is also required to use insulin injection. So these are the ways diabetes mellitus 2 affects humans in general. But there is something we call pathophysiology of diabetes mellitus. This has to do with the raised plasma level or plasma glucose level in the body. So after eating a rich carbohydrate diet of food, the plasma glucose level remains high because 1. Cells are unable to take up and use glucose from the bloodstream despite high plasma levels. Secondly, conversion of glucose to glycogen in the liver and muscles is diminished. So instead of converting glucose to glycogen needed for the liver and muscles, it becomes very low, which leads to fatigue. And there's also what is called gluconeogenesis from protein in response to deficiency of intracellular glucose. These are some of the pathophysiology of diabetes mellitus. That is not all. We also have what is called glycosuria and polyuria, a situation whereby the concentration of glucose in the glomerular filtrates is the same as in the blood. And although diabetes raises the renal threshold for glucose, it is not all reabsorbed by the tubules. So while there is need for glucose in the blood, all the other factors cannot get enough of it, neither can they use it, because it is just too much, or it is not reabsorbed by the cells or the tubules in the body. So the glucose remaining in the filtrate raises its osmotic pressure. Then there is water reabsorption, which is reduced, and the volume of urine is increased, known as polyuria. This results in electrolyte imbalance in the body and excretion of high dose of urine coming out from the body. So polyuria leads to dehydration. Because there is high dose of urination, it now leads to dehydration, because the water coming into the body is always excreted through urine. So there's no enough water in the body to sustain the hormonal balance of the body system, which thereby lead to great thirst, known as polydyspepsia, and increased fluid intake. Other pathophysiology of diabetes mellitus is weight loss. Those who have diabetes mellitus type 2 diabetes always have weight loss. This happens as a result of the cells being starved of glucose due to the absence of insulin in the body. They are unable to extract it from the bloodstream. The cells cannot extract it, so leading to the arrangement of energy metabolism, as cells must use alternative pathways to produce the energy they need. So the cells cannot get enough energy because of the absence of insulin in the body, and due to the derangement of energy metabolism, that is why this actually occurs. So it cannot get all the insulin it needs to produce energy for the body. This results in weight loss due to what is called gluconeogenesis from amino acids and body protein, causing muscle wasting, tissue breakdown, and further increases in blood glucose. Catabolism of body fat, releasing some of its energy, and excess production of ketone bodies. These are some of the severity or complications of having diabetes mellitus 2. Then you also have ketosis and ketoacidosis. This actually affects people with type 1 diabetes mellitus because of the absence of insulin to promote normal intracellular glucose metabolism, whereby the glucose is available for the cells to use in the body. But when this happens, there's no glucose available for the cells to use, and the cells have to fight to find glucose by all means by taking it from the fats in the body, which actually led to one losing weight. So what are the acute complications of diabetes mellitus? We have what is called diabetic ketoacidosis. The effect and consequences of diabetic ketoacidosis are hypoglycemia coma. This is a situation whereby insulin administered is in excess of that needed to balance the food intake and expenditure of energy. Hypoglycemia is of sudden onset and may be the result of either accident overdosage of insulin. Secondly, delay in eating after insulin administration. After taking insulin, you delay in eating your food. Or drinking alcohol on an empty stomach. Drinking alcohol before eating food.